Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I am a UK registered nurse of 20 years and I am a university lecturer and I currently teach on the Masters in Clinical Education. And I've been an NMC OSCE programme lead for a local trust, training hundreds of nurses with a really good pass rate. So I'm sharing with you my advice and teaching to help you self-study and to prepare for your OSCE exam. I also provide one-to-one private OSCE tutoring with some great results, and just to if you need that little bit of extra support with your OSCE study. Well done to all those people who put on the channel that they have passed the OSCE with self-study and using my videos. It's an absolutely brilliant achievement to pass your OSCE first time through self-study. So well done to all of you. I'm so proud of you, and I just wish you all the best. So I wanted to do a video today about my top advice on how to prepare and pass for your OSCE. Okay, so I pick up a lot of students that are on second and third attempts, and that's fine. It's a really difficult exam, and some people don't pass first time. It's just one of those things. But there are definitely things you can do which can improve your chances of passing first time, and I want to share that information with you today. Okay, so I want to do 10 tips. But I couldn't get it into 10, so I've done 12 essential tips to prepare and pass your NMC OSCE. So the first one is time. You must give yourself adequate study time and preparation. And I just want to really stress, it doesn't matter how inexperienced nurse you are, you cannot pass your OSCE in a week. You cannot book onto an OSCE training programme and then book your test next week. Very unlikely that you're going to pass first time. Some people might comment to disagree with that, but you do need to prepare. I always say to my nurses, a minimum of 6 weeks, but ideally 8 to 12 weeks to prepare for your OSCE exam. You are needing to demonstrate the knowledge of a newly qualified nurse who's been through 3-year NMC approved university programme. So you absolutely need to start your preparation as early as possible and practice and give yourself enough time to study. My second one is plan your study. Put together an achievable study plan for you. Okay, everyone's going to be different. Some of you are working, some of you have got families, some of you are just young and enjoying like London life and things like that, which is absolutely fine, but you need to have a really clear study plan. You need to prioritise your study as much as possible. And I would block time in your calendar where you're going to do your dedicated OSCE study and make it non-negotiable, okay? Really important. The content for the adult OSCE can feel quite overwhelming because there's quite a lot of it. It's not difficult content, but there is a lot to learn and in order for you to perform that in the exam. So you need to put an adequate amount of study in order to achieve that. I've started making study plans for my full-time tutoring clients because I appreciate that it can be overwhelming. You don't know where to start. Okay, so get yourself a really good study plan, break down the content and give yourself set tasks to do regularly. But also make sure you've got rest days and some no study days as well. So don't be studying 7 days a week. That's not effective for anyone, but definitely, so make sure you've got some rest time and some fun time as well during your OSCE study. Number 3. Use your nursing knowledge. I cannot stress this enough to you as internationally educated nurses. Do not forget you are a nurse. Yes, a trained nurse, a registered nurse in your own country. You have been through nurse education. And it's so important in your NMC OSCE exam to not forget that, okay? So use your existing knowledge, okay, and apply this to your NMC scenarios and stations, okay? You don't have to relearn these things. These are things that you should know and be familiar with. You might not have done them for a little while, for example, but there's nothing in that exam beyond the requirements of a nurse, okay? So don't forget your nursing knowledge and don't be afraid to use your nursing knowledge. I always say to my tutoring clients, do the skills in a way that feels best and natural for you. How are you used to doing the skill? Let's do it that way. And then we'll add in those specific NMC requirements just to make sure it's hitting all those requirements, okay? You don't need to relearn things. You just need to build on your existing nursing knowledge. Number 4 is obviously understand the exam, okay? The NMC OSCE exam is a very expensive exam, as you'll be aware of. It's a very structured exam with very set requirements. You need to be up to date and aware of the exam structure and content. and that is always regularly upposted and updated on the NMC website. And you should be checking that NMC website, I would say at least weekly if you are preparing for your NMC OSCE. The marking criteria can change without like any announcements, so just a new version goes up and gets uploaded. So it's important you are looking at that marking criteria weekly and checking if there's any changes. Ensure you're practicing as per the latest updates. There's been a whole load of new updates on the 30th of September, so you should be using those, and your sources of information should be following those as well. Be familiar with the marking criteria, okay? Don't memorise the marking criteria. I'm not into memorising the marking criteria. You shouldn't need to memorise these things. You are nurses. You should understand the concepts of these skills and stations that you've been asked to do. And also the NMC do not like what we call rote learning, where you just go in and memorise everything. But you need to be familiar with the marking criteria and how the exam is assessed, okay? The exam is assessed following evidence-based best practice. So a lot of procedures and things that you'll find, you know, NICE guidelines, World Health Organization, Royal Marsden Manual, NHS England. So it is assessed on that. And it's also not just solely assessed on the marking criteria as well. You need to be demonstrating your nursing knowledge, okay? So you are assessed on other things beyond just what you see on the marking criteria. And this brings me on to my next point, number 5, understanding why, okay? Like I said, just memorising the marking criteria is not really enough to pass, and it's not ideal if you're going to be going on and getting a job in UK healthcare, because you absolutely need to be understanding what you are doing and why. The examiner may ask you some questions to test that knowledge if they think you are demonstrating memorised rote learning. So a lot of test centres and training centres use this approach. It's very obvious and clear to see as an examiner, or when you observe someone's practice, that they are remembering, but they haven't linked. They haven't what I call connect the dots. What you're doing, how the patient's presenting, with your background information, and understanding why you're doing all those things. So that is really important. You should be understanding why you are doing each of these things on the marking criteria, because there is a reason for it, okay? Predominantly a patient safety reason, or you know, it's obviously linked to the best available evidence. So they all have a purpose, and you should understand why you are doing them. Also, if you understand why you're doing these things, it's way easier to remember and to do them in the exam, because they have context, okay? And they have a purpose, rather than just trying to memorise 80 pages of text, which is totally out of context of what you're doing. Number 6, break it down, okay? Like I said, a large amount to get through, especially for your adult OSCE, so break the content down into manageable sections, okay? Try and simplify the processes to start off with, you know, so write that skill down as bullet points. Look for similarities in skills. So I know for all my medication clinical skills, I'm always going to have to do my ID checks. I'm always going to need to read that prescription and confirm that prescription. So look for things where you can reduce the cognitive load, okay, and apply similar things in similar stations, okay? And it is way better to do 2 hours of real focused study than doing a full day of poor study, if that makes sense. So break your content down, use your study plan, be focused and be committed to the subject you are picking, okay, and work on that for a set period of time, and then have a break. 7, practice, obviously. Practice is absolutely essential, okay? Practice to time, so with a timer, and start early, practicing to time. A lot of nurses are like, always feel a bit, oh, I don't want to put the timer on, it's stressful. Get used to having the timer on, okay? Get used to feeling what 8 minutes feels like in a station, what 20 minutes feels like to do your A3 assessment and your holistic assessment. Get used to that time. The earlier you can practice with the timer on, the better. It also can be really rewarding, because as you continue to practice, you'll notice you'll get better and better, and your time management will be better, and that gives you a nice personal boost as well. Practice verbalising out loud, okay? This is something we can feel quite awkward doing, okay? But find yourself a quiet room and practice verbalising out loud. Huge amount of the NMC OSCE exam is assessed due to on your verbalisation, okay? Verbalising what you're doing and why. And so you need to get into the habit of doing that, okay? Not feeling awkward about it, and just practicing out loud. And practice all your stations. So all the API scenarios, okay? All your clinical skills, all your written stations. You must practice them all. They can all come up and be assessed. If you're using any training platforms, you should have access to the full content of the NMC exam, so you can practice all requirements. Feedback. Feedback is essential. It's the most effective thing to improve and develop learning across the whole of education. So you must get feedback. So whether that's through your training centre that you've booked, or your online course, or your friends and family, you must get feedback. Now, if you are practicing by yourself, feedback can be a little bit challenging. So always tell my nurses to record yourselves on your phone. Okay, set your phone up, record it. When you finish, go back and listen, okay, or watch it. You will then see how you are performing, and that is such a good way of feedback. So I just say that to everyone, whether you paid for a training course or tutoring, whatever. Film yourself and self-review yourself. You can then watch it back. You can see how clear that station looks, what you've missed, look at the marking criteria, what you are missed, what you've done maybe in not quite the best order, where you've wasted a lot of time. Maybe you need to like speed that a little bit up to get time to record yourself on your phone. Absolutely brilliant tip for you to do if you're practicing for your OSCE. 9, resources. So if you are paying or accessing for resources, you need to get them as early as possible. Okay, like I said, I would ideally say 8 to 12 weeks to practice for your adult OSCE, especially if you're working, got other commitments. So you want access to those resources as early as possible. Okay, if your training course are withholding resources and not giving them to you, or only giving them to you for a limited time, I would stay well away from those courses. Okay, get your resources early. Keep to one or two sources, which is up to date to avoid confusion. Especially with things like clinical skills, everyone will go about it in a different way. It's absolutely fine, as long as it's safe, as long as it covers the skill. Patient safety, it's evidence-based, but people might do it a different way. And so if you're watching lots of different videos, it can get very confusing. So find a source that works for you, okay, and stick with it. And just ensure your resources are evidence-based and aligned with the exam assessment criteria. Training, okay. So lots of people self-study, so you don't need to pay for training, okay? But if you do, make sure you get some hands-on practical training, either at a training centre, at tutoring with me, or online, that you are practicing these stations, either verbally, out loud, online, or in person, okay? It's a practical exam. You need to be practicing, and that is what you should be paying someone for, okay? Information is widely available on the internet for free. What you should be spending your money on is getting someone to observe you, give you feedback, and to practice. Make sure there's a small groups or high staff to student ratio, okay? You don't want to be in a group of 40, okay? It's pretty ineffective. So make sure you are asked these questions when you're thinking about booking your training, okay? I always advocate that your training courses should be delivered by NMC registered nurses, okay? And they should have an education qualification. Make sure your training course covers all the content of the exam, all API scenarios, all clinical skills, okay? And that gives you access to resources, but also ongoing support. Because the whole process, once you've passed your exam, if you need resits, it can become quite overwhelming. You want that contact and that point of support to help you. Oh, and I'm on to support as a separate point. So having support is really important. So from families, friends, or your trainer or tutor, can make your exam feel less overwhelming. It can help you keep focused and motivated. And it just provides someone to talk to and to share any worries. And you can also use that person to practice with. It doesn't matter if your partner or friend is a nurse, give them the marking criteria, tell them key things they need to be looking out for, and practice with them. So support is really important. And also if you're going through multiple attempts, it can become really demoralising for you and really stressful. So make sure you've got some area or someone who can support you with this. And my final point is confidence. Having confidence is essential to pass, okay? Your OSCE preparation and studying should leave you feeling confident and ready for your exam. Okay, so I do a lot of work around confidence and building confidence because I know that directly impacts results. And I tell all my nurses to go into exam knowing you can do this. You're a registered nurse, you're an experienced nurse, you've prepared well, you've prepared fully, and you're going to that test centre to demonstrate to those examiners your knowledge and skills. You're not going there to be tested and to be put on, scrutinised. You are going there to give them a demonstration of how wonderful and amazing you are. And I'll tell you, that goes such a long way in your NMC OSCE exam. So I hope these things have been helpful. And how do I incorporate all of this into my tutoring? Well, I try and, keep up to date with evidence-based teaching, all the time. And I always ensure you understand why you are doing everything, okay? I will personalise OSCE training and planning for you, so make it work around your strengths and weaknesses. I personalise my study plans, and I've started doing like weekly tasks and study plans for my kind of full-time students. I use a scaffolding approach, so just very gently building up the layers of this knowledge of this OSCE exam. So we start with the fundamentals and then we take it all the way up. It's a really known educational technique for teaching as well. I'll give you access to my resources as early as you want them. If you want them 6 months in advance, you can have them 6 months in advance. I'm not bothered about that. And I don't see the point in retaining knowledge when people want to have it. I'll give you feedback on all your stations, online or in person. And that's the joy of doing one-to-one tutoring. I'll give you lots of practice time, okay? So my sessions are all about practicing. I give you all the information and all the tasks to do to build your knowledge, okay? So you're not paying me to speak to you and give you information. You're paying me to tutor you, to give you feedback, give you practice, give you advice, and hopefully give you lots of support and confidence building as well. So I hope that's helpful. Again, really important things to think about before you start your NMC OSCE study. Do it once and do it right. And you should save yourself a lot of money and stress in the long run.